Hi, I'm Laura,
I'm Melanie.
I'm Kristen.
And I'm Benita.
and we're nurse educators from Houston, Texas. And we're committed to decreasing maternal mortality by delivering and practicing via the latest and greatest evidence-based practice guidelines.
Delivering respectful maternity care to every patient, every interaction, every time.
Focusing on quality and process improvements.
And ensuring that the birthing person is always at the center of everything that we do.
Maternal morbidity and mortality in America is a true health crisis. We have to do better. I'm committed to reducing maternal mortality by always following best practices, committing to ongoing continuing education, and advocating for all patients to receive high quality, equitable health care in all the corners of our country. I hope that you are too, because change truly starts with us.
Hi, my name is Margie Bridges, and I commit to reducing maternal mortality by serving my third term on the Maternal Mortality Review Panel for Washington State. In my work as a perinatal clinical nurse specialist, I really hope to make a difference in maternal morbidity and mortality through identification, development, dissemination of evidence-based practices really aimed at preventing preventable maternal mortality. This commitment really includes leveraging AWHONN as a leader in research, education, resources, and advocacy to prevent maternal death. I will also commit to listening, treating, and advocating for all of my patients. And when I say all, I mean this means integrating the principles of diversity, equity, inclusion, and justice in this very important work. I have made a difference in combating maternal mortality and morbidity, and this is through implementation of many best practices around things like hemorrhage, hypertension, sepsis, and substance use disorder, just to name a few. The call to action is so important. We know that we can do better. We know that we need your partnership. I know that I will never surrender. I am never going to give up. And I want to thank you for your partnership in supporting AWHONN and your commitment to our patients.
Hi, my name is April. I am a women's health nurse here at Nebraska Medicine. Thinking about this video, it really saddened me to think about how mortality and morbidity still is at a critically high percentage here in the United States for maternal health. For example, Black women are 3 times more likely to die from a pregnancy-related death compared to white women. I am not okay with this. With the medical advancements in technology here in the United States, that this percentage should not be this critically high, and we need to do something. We need to be better as healthcare providers. As a bedside nurse, my promise is to, be that patient's eyes and ears. I am their biggest advocate and supporter, and my promise is that if I see something that is unsafe, that I will say something. And as a childbirth educator, which I also do here at Nebraska Medicine, my promise is to provide quality education to these families that starts in early pregnancy and extends all the way through postpartum. I want these women to feel informed, to have them feel empowered so that they can, be included and feel like they are making healthcare decisions that not only affect them, but their families also. We need to get the resources to these families so that we can have some better positive maternal health outcomes.